Nurse Aide Certification Sample Test. Let's get started. A resident often carries a doll with her, treating it like her baby. One day she is wandering around crying that she can't find her baby. The nurse aide should: Is it A, ask the resident where she last had the doll? Or B, ask the activity department if they have any other dolls? Could it be C, offer comfort to the resident and help her look for her baby? Or lastly D, let the other staff know the resident is very confused and should be watched closely? The correct answer is C. Here is why. The priority is to address the resident's immediate emotional distress with empathy and support, validating her feelings while assisting in the search for the cherished item. Asking where she last had it relies on a memory that may be impaired due to her confusion. Requesting a replacement doll dismisses the significance of this specific object to the resident. Informing other staff about her confusion is a secondary action that does not provide the direct, compassionate response she needs in that moment. Next question. A nurse aide is asked to change a urinary drainage bag attached to an indwelling urinary catheter. The nurse aide has never done this before. The best response by the nurse aide is to: Is it A, change the indwelling catheter at the same time? Or B, ask another nurse aide to change the urinary drainage bag? Could it be C, change the bag asking for help only if the nurse aide has problems? Or lastly D, ask a nurse to watch the nurse aide change the bag since it is the first time? The correct answer is D. Here is why. For a new, skill-based task involving sterile technique and medical equipment, the safest and most responsible approach is to request direct supervision from a licensed nurse for the first performance. Attempting to change the catheter itself is far outside the aide's scope of practice and would cause significant harm. Asking another aide assumes they are competent and shifts responsibility without ensuring proper oversight. Trying alone and only seeking help if problems arise is risky, as mistakes could occur before help is requested, potentially introducing infection or damaging the system. Next question. Before feeding a resident, which of the following is the best reason to wash the resident's hands? Is it A, the resident may still touch his/her mouth or food? Or B, it reduces the risk of spreading airborne diseases? Could it be C, it improves resident morale and appetite? Or lastly D, the resident needs to keep meal routines? The correct answer is A. Here is why. Hand hygiene before eating is a fundamental infection control practice because residents frequently touch their food and face during the meal, transferring microorganisms from their hands. Hand washing primarily prevents contact transmission, not airborne diseases. While it may have a positive psychological effect, improving morale is not the primary health-related reason. Maintaining routines is beneficial, but the core rationale is rooted in preventing illness, not just preserving schedule. Next question. Which of the following is a job task performed by the nurse aide? Is it A, participating in resident care planning conferences? Or B, taking a telephone order from a physician? Could it be C, giving medications to assigned residents? Or lastly D, changing sterile wound dressings? The correct answer is A. Here is why. Nurse aides contribute valuable observations about residents' daily functioning and responses to care during interdisciplinary team meetings. Accepting physician orders is strictly outside their scope and must be done by licensed personnel. Administering medications is a licensed nursing function, not a nurse aide duty. Performing sterile dressing changes is also a skilled nursing task requiring sterile technique, not typically assigned to aides. Next question. Which of the following statements is true about range of motion ROM exercises? Is it A, done just once a day? Or B, help prevent strokes and paralysis? Could it be C, require at least 10 repetitions of each exercise? Or lastly, D, are often performed during ADLs such as bathing or dressing. The correct answer is D. Here is why. Integrating gentle movement into daily care activities like dressing or bathing is a practical, functional way to maintain joint mobility without requiring a separate, formal exercise session. ROM is typically performed more than once daily to be effective. While ROM maintains joint function, it does not prevent the neurological events that cause strokes or paralysis. There is no rigid rule requiring 10 repetitions. The number is based on the resident's tolerance and care plan. Next question. While the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should. Is it A, put the hairbrush away and out of sight? Or B, give the resident the hairbrush to hold? Could it be C, try to dress the resident more quickly? Or lastly D, restrain the resident's hand? The correct answer is B. Here is why. Allowing the resident to hold a safe, familiar object can provide comfort, reduce agitation, and occupy their hands, making the dressing process easier and less confrontational. Removing the desired item may increase frustration and resistance. Rushing through care increases anxiety and the risk of errors. Physically restraining the hand is a violation of the resident's rights and is never an appropriate response to this behavior. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.